Hey guys, my name is Journey Delora, and today I'm going to be talking about policy formulation, specifically focusing on expanding medication assisted treatment known as MAT. So, what is MAT? It's an evidence based treatment used for opioid use disorders. It combines FDA approved medications and behavioral therapy. It reduces overdose deaths and improves recovery outcomes. So, it affects patients, providers, criminal justice systems, and employers. And then on the side right here, those are three administrations that support MAT. There's going to be the Substance Abuse and Mental Health Service Administration, which is a U.S. government agency within the Department of Health and Human Services that leads public health efforts to advance behavioral health of the nation. They support a lot of addiction organizations. And then the Drug Enforcement Administration is a U.S. federal law enforcement agency within the Department of Justice that combats illegal drug trafficking, enforcing Controlled Substances Act, and manages domestic and international drug investigations. And then the FDA is a U.S. federal agency responsible for protecting public health by ensuring the safety, efficiency, and security of human drugs, biological products, food supply, cosmetics, and etc. The FDA controls a lot. So, what is the policy problem? So, 1.25 million overdose deaths since 1999. 70% of those deaths involve opioids, and only less than 10% of people seeking treatment receive medication-assisted treatment. It is very, very rare, and a lot of places do not offer it, and it's limited access in jails and prisons just because the criminal justice system does not believe in MAT or a lot of addiction services that will help. And over here, I have a diagram showing all of the deaths per 100,000 residents each year, and as you can see, opioids is rising and all drugs is at its highest, and it just continues to rise if we don't do something about it. So what is the current status quo? So the expansion of buprenorphine prescribing, the elimination of federal X waiver requirement, and it continues disparities across states, Medicaid prior authorization barriers, and uneven telehealth and rural access. There are a lot of inequalities that go along with MAT, and a lot of organizations just do not support it, or it just does not have enough funding, and a lot of people are not educated enough on addiction services, so they don't offer it a lot, and there's just a lot of disparities and inequality regarding addiction. So here's some legislation acts that have been passed that have been for addiction services to help people. So the Consolidated Appropriations Act, funding by the federal government operation, then it combines individual appropriation bills into one to strengthen national security. And then support, which got passed in 2025. Well, it got passed, I think, originally in 2018, but they had to re-sign it in 2025, and extends crucial substance use disorder prevention, treatment, and recovery programs through fiscal year of 2030. So that gave out billions of dollars for the federal government to use to help substance abuse disorder prevention and recovery programs, which is amazing. So the policy formulation goals is to reduce regulatory barriers, expand provider participation, improve rural and justice system access, maintain fiscal feasibility, and preserve federal state balance. We want to make these inequalities not as much, and we want to lessen those gaps so that more people can receive the help that they need to recover. So my first policy alternative is the Medicaid reform. We eliminate Medicaid prior authorization for buprenorphine because that's where a lot of the limitations cause to happen, just because a lot of you just got to get screened for Medicaid for buprenorphine, which it helps addiction. So we want to reduce administration burden, increase rapid treatment initiation, and enforce mental health parity audits, and budget neutral efficiency reform. The appeal in this is economic efficiency and bipartisan support potential. The second policy reform is rural and telehealth expansion. So we want to target grant incentives for rural provider training, telehealth MAT delivery, and workforce development. This is going to be built through Substance Abuse and Mental Health Services Administration funding streams. They have a lot of funding streams that you can go through, and they really want to help people We are trying to help people with addiction and recovery, so there's a lot of funding that we can go through. And the appeal for this is regional equity and builds on existing federal infrastructure. So you're just using infrastructure that we already have and building just a stronger connection and a stronger positive impact for recovery. So policy alternative, the incentive number 3, is incentive-based integration. So tax credits or reimbursement bonuses for primary care practices. We want to integrate MAT into a routine care and normalize addiction treatment, reduce the stigma and incentive provider participation. We want to normalize people getting treated for addiction, and we want to help those people. The appeal is market-based approach, and it encourages voluntary adoption. And over here, I have a little thing about treatment for opioid addiction and how it can normalize brain chemistry, ease cravings, and prevent some withdrawal symptoms. So we just want to normalize it. And here are some comparisons of the different alternatives that I came up with. And this is the graph that I put up with. So, in conclusion, medication-assisted treatment is evidence-based and cost-effective. Federal reforms improved access, but gaps remain, and incremental policy alternatives can reduce disparities, improve overdose outcomes, and strengthen public health infrastructure. By expanding MAT access through targeted reforms, it's represented a pragmatic response to the ongoing opioid crisis. MAT is just focused on responding to that opioid crisis, and we want to help people with recovery and expand profits and expand any organizations that will help MAT. Thank you.